Hey, it's Barbara, and I am now about 6 weeks, I guess, out from my thumb surgery, and I thought I'd come here to show you what it looks like and how I'm doing. So this is my one incision is here, and another one is here. I can't turn my hand that way yet. So, and then this is top of my hand. It's not it doesn't look like it normally does, or like it will get better. And here is, whoops, see, the place where that's where my incision was for my thumb. And here's my thumb. It does not come out. It's still very tender. I just had the cast taken off yesterday, and but I got my rings back on, so there's a plus. And I don't know if you can see it, but see the difference in my wrist right now. This is more flat, and he wanted me to do a my surgeon wanted me to do a it's like a plaster mold cast. However, I asked him if I could not, because I've tried it before and it was very uncomfortable. And I ended up getting stuck with a bill because my insurance considered it as a prosthetic, so therefore they wouldn't cover it. And I didn't want to go through that. And when I tried it before my surgery, I don't know, sometime last year maybe, I tried it, and they were very uncomfortable. They hurt. So it hurt worse to use them than to not. So I didn't. I still have to wear a brace, though. He said I could give it a try. A brace to keep it mobilized as much as possible. He doesn't want me to move it much. I can do this, but that's all he wants me to do. He's increased my weight limits from 1 pound to 5 pounds. And it's very tender, very, very tender. And I'm sure it's just from taking that cast off, which that cast was holding it so secure. I was almost willing to get another cast on, as opposed to doing that brace thing that they were talking about. So that's how good it is. And I can't hold it straight yet. I can if I force it. However, right now, it doesn't do that on its own like this one would. So, and you can see the difference in my hands right now. And I do have to have surgery on my right hand, but I'm going to wait for a few months until this one's completely healed at least. So, there you have it. And you can see it's tight. It really is tight right there. And so there was a lot of dead skin, and I must have washed my hand for 10 minutes after they took the cast off yesterday. Because the weather's been kind of hot here in Delaware, and I was sweating. I was at a wedding on Saturday and was sweating, and so annoying. But all in all, I'm still glad I had it done. It is another pain as opposed to the pain I was having. It's a total different pain, but that's going to go away. I have no doubt. In fact, last night I talked to my sister, my twin sister. She had to have it done. And the one thing she wasn't able to do is that. And I can. So he thinks I'm doing pretty awesome. And I shouldn't have to have physical therapy. He said most of his patients don't have to. I had Dr. Kalan in Delaware at First State Orthopedics. Absolutely the most amazing surgeon I've ever met. His personality is awesome. And I would absolutely highly recommend him to anybody. He is a very good surgeon. So, yeah, so I'm limited. Like I said, I got to put my brace on. Hold on, baby. That's my grandson, sorry. I got to put my brace on and keep it on for another 4 weeks, and then go from there. So, I'll keep you updated and let you know how I'm doing. But, anyway, bye. If you have any questions, just send me a message.